Chief of the World Health Organization has said he is deeply concerned about the scale and speed of the Ebola outbreak in the Democratic Republic of Congo and Uganda. Health authorities believe it has caused more than 130 deaths so far. The CDC says at least one American has tested positive, a Christian missionary in the DRC. His wife and 4 children, as well as another physician, are also being monitored. A Congolese virologist says the outbreak is especially risky in the east because of high population density, constant movement, and managing a virus in a conflict-affected area. The United States is moving to limit entry from the affected region.
So to get a better understanding of this virus, we are joined now by 9 News medical expert Dr. Payal Kohli. Welcome, Dr. Kohli. I'm glad that we're talking about this.
I know. I feel like it's, something you talk about every few years or so, but can you remind us, what is Ebola? What are the symptoms? What is this disease?
It's a viral infection, ladies, and it can cause pretty severe symptoms. You remember those movies where people were bleeding out from every orifice? Their eyes, their nose, their gums, their mouth. That could be a consequence of severe Ebola. Now, thankfully, that happens in a minority of cases. It starts out like a flu-like illness, and then it can progress to multi-organ failure and shock. But it's a viral infection. What has us worried is that this strain is a bit unusual.
And why is this strain unusual from the previous strains, and how does it spread?
So this strain is unusual because we don't have a vaccine and we don't have any viral treatments. And that's what has people really worried, because the infrastructure, as you said, Alex, is not there to support it. We've seen that it's already spreading country to country, so it's gotten into Uganda already. And we also know that it can spread through contact with bodily fluids. So that's where it's different from COVID or flu or even the hantavirus that we've talked about. It doesn't spread through casual airborne transmission. But as you pointed out, even healthcare workers that are down there coming into contact with blood, vomit, secretions, feces, any contaminated bedding, anything like that could potentially contract it through that mechanism. So essentially what ends up happening is you get exposed to the virus, it gets in through your eyes, your nose, your mouth, some mucous membrane, or through broken skin, and then it starts to infect all these organs in your body. You're talking your liver, you're talking your blood vessels, and it can create this hemorrhagic shock type of picture where the blood vessels start leaking fluid into every organ of your body. You start bleeding out, and your immune system essentially collapses.
Well, that all sounds very terrifying, and now we know this is happening on, another continent. But what is the risk here? Should we be concerned in the U.S. and specifically Colorado?
Well, so that's the good news here, because it doesn't spread through casual sort of airborne transmission. It's not going to just get on a plane and come here and not realize it. The other good news about this virus is that it's a relatively short incubation period, which means, let's say you happen to be exposed today, it would take 2 days to 21 days before you started to manifest symptoms. You can't spread it when you're not having symptoms. You can only spread it once you start having symptoms. And after those 21 days, if you're not declaring yourself, you're probably not going to get it. So it follows a nice sort of reliable transmission pattern, which means that hopefully we can contain it. But if there's not an infrastructure there to treat the people that are sick, there's not an infrastructure to protect bodily secretions and such for healthcare workers, we start to worry about how this will get contained and how this will get treated, because the mortality can be really high, 30 to 50%.
30 to 50%.
Yeah. But here in Colorado, thankfully, we're safe. Now, it's a strong advisory from the state that we should not travel to a region affected with this virus right now. If you choose to travel, you're obviously higher risk and you want to make sure you follow all those precautions. But if you're not traveling there, you're just here in Colorado, the chance to the average American is actually quite low.
Dr. Kohli, thank you for your insight.